So musculoskeletal disorders are a group of disorders, and it encompasses arthritis, and there are many different types of arthritis. In fact, there's over 150 different types of arthritis. But despite being the leading cause for disability, there's a major mismatch between the burden and what's available for research. Enormous impact on the person living with those conditions. They very often have to retire earlier, their savings base is not as great, they can't fulfil their roles in terms of manual work, but they also can't fulfil their family roles. But that's also major loss of productivity to the society as well. So it sort of goes both ways. The individual loses out and society loses out. So I do multiple roles. I'm a clinician, and at the coalface I'm an advocate there for my patient, and so I'm wanting to get access to the best available treatments for them. But as a researcher, I'm always looking for new treatments. I've been very fortunate that many of my patients share the same ideals. We've done a lot of clinical trials here for osteoarthritis and rheumatoid arthritis, trying new treatments like stem cells, and so I like to embed research within the clinical practice, and that informs that to answer important questions, in questions that we just don't have the answers to. We don't know what causes arthritis. Okay, we make a diagnosis of rheumatoid arthritis, but it can affect people in so many different ways. And we've got all these wonderful new treatments, yet they don't work in everyone. And in fact, some people have some very bad side effects from these drugs that are meant to be trying to totally control their arthritis. So there's so many unknowns and so many important questions that we need to find answers to. We've got an exciting new project, the biobank, so the A3BC we're calling ourselves, so the Arthritis and Autoimmune Diseases Australian Biobank Collaborative. Our vision is to build on a registry that we already have, a national registry for people with arthritis. Over 3,000 patients have been giving us wonderful patient-reported outcome data over many years now. But the key piece of information missing has been their biospecimens. So now we've launched this national collaborative, a fantastic team around Australia of rheumatologists and scientists that are sharing the vision, and we're the lead site here at the Institute of Bone and Joint Research and Colling Institute, Royal North Shore Hospital, Sydney University. That's us here leading that. And our vision is to collect blood, so the immune cells from blood, the proteins in the blood, to collect synovial fluid and the immune cells in the fluid, tissue if they're having their joints replaced or joint surgery, microbiome, so we'll be getting samples of saliva, samples of feces, so poo samples, and I think very fascinating new work around how your bacteria might influence your immune system, but also how you might respond to the drugs, because we know people respond very differently. Musculoskeletal conditions and arthritis, it can kill you actually, and maybe we can even cure it if we really develop the right resources and research infrastructure. If we set out with that vision that we want to cure it, and then maybe we will one day, and that's certainly what we're trying to do here.